Thousands of people at hundreds of tables from all corners of our region are making an impact.
On the Table Milwaukee is powerful because it brings people together.
We are breaking bread and connecting communities.
It brings diversity to the table of age, of color, of community.
There is a much greater awareness of needs in our community. Homelessness, transportation, childcare.
We're going to be successful by us working together and supporting each other.
People are collaborating, partnering,
I see people of really different thought.
and strengthening our community together. Something remarkable happens when you mix diversity and dialogue.
Anytime I would see people that were of different cultures.
We don't get to do that very often today, to come together with people whose backgrounds are not necessarily the same.
Acknowledging each other, seeing each other, and listening to each other's story.
I think that will help us build that resilience.
It starts around the table.
When personal stories are shared,
I didn't have a father in my life either, so.
connections and commitment deepen.
I don't know one person who left today's On the Table not moved and deeply impacted by the conversations we had here today. Ideas were exchanged and tears were shed.
It motivates us to be present and to be a part of the solution.
Somebody actually said that they were being vulnerable, so it really is a safe space for people to bring their full self.
It is so gratifying to see so many people want to engage in moving our community forward. Since the first year the Greater Milwaukee Foundation introduced On the Table, we have moved from conversation to dialogue to relationship building to ideas to action.
Spanning topics like advancing racial equity,
People want more transportation. They want more opportunity. They need funding.
promoting entrepreneurship,
And I think that you have to do that through cross-cultural partnerships. You have to do that through cross-sector partnerships.
and criminal justice reform.
We know that people are really passionate for change, that transformational change is coming.
If On the Table continues to engage the community on this topic, you'll see stronger families, you'll see more men active in their families.
Standing up to bullies,
I think the youth have a voice and we're here to listen.
and harnessing faith to fight gun violence.
To be able to share my story is powerful because I can change the narrative for other women.
Sharing your story is healing, but we understand that we need to enact policy so that other people don't go through the same things.
Where collaboration today is generating solutions for tomorrow. Your voice matters at On the Table MKE.
Good afternoon, everyone. Thank you all for taking this time out of your day on this beautiful fall day to join us at the Greater Milwaukee Foundation for our On the Table series this year, themed Healing Justice. I'm very excited and honored to be able to share some information or share details around our panelists who will be providing input today and answering some questions that we have prepared for them. Building community, an ecosystem for change. Today we have panelists. We'll start with Ms. Danelle Cross. Ms. Danelle Cross has two passions, education and community. She is a former resident of Metcalf Park neighborhood, and she has worked and invested 9 years and more into the community. She's one of the founding members of the Metcalf Park Community Action Team, and she serves as the coordinator for the Build a Neighborhood Capacity Program in Metcalf Park. Her experience with members from the community and her mission to support resident leaders and build partnerships to promote a safe, healthy, and vibrant community. Thank you so much for joining us, Danelle. Dr. Zeno Franco. he has been recognized for his leadership in the Dry Hooch Partnership for Veterans Affairs, a veteran serving organization that's founded in Milwaukee. He creates community strategies to engage veterans and works to generate financial support for the Veterans Treatment Initiative. Dr. Franco is involved in the Wisconsin Veterans Health Coalition and the organization of Warrior Summit conferences, and recently edited a special issue on collaborative research strategies with veterans. His works includes working with various community initiatives, including the Latino Alzheimer's Coalition, Institute for Urban Agriculture and Nutrition, Walnut Way Community Research Council, Humboldt Park Friends. In addition, Dr. Franco is the co-principal investigator for the National Research Program, All of Us, one of the largest, most diverse precision medicine efforts ever taken nationwide. And last but not least, we have Dr. David Nelson. He is passionate about the concept of community. It is woven into his research, his teaching, and many of his other professionals and personal endeavors. Talk to him for a length of time, and he will share the quote that fuels his passion: "To whom much is given, much is expected." Dr. Nelson is Associate Professor of Family and Community Medicine, who leads many of Medical College of Wisconsin's community engagement efforts. As part of this work, he partners with public and private organizations to enhance learning, research, patient care, and the health of the community. Much of his work involves leaving campus and going to the places where the people he wants to help live, work, and play. And our moderator for today is Jordan Roman. He is the Political Advisor Chair of Milwaukee Urban League Young Professionals, an immediate past president of the Milwaukee Urban League Young Professionals, and one of the drivers behind Getting the Vote Out Collective MKE. So I want to thank you all for joining us today, and I'm going to turn it over to Jordan, who will moderate our panel discussion with our wonderful community members. Thank you for joining us.
Thank you very much, Dan. So how's everybody doing? As you said, my name is Jordan Roman, the immediate past president for the Milwaukee Urban League Young Professionals and the current political advocacy chair. A little brief history about myself. I served on for the Milwaukee Urban League for going on 4 years now, 2 years as the president, and now going into my second year as the treasurer and political advocacy chair. Also sitting in a couple of national committees in the political advocacy world as an advisor at that as well. So a resident and native of Milwaukee, Wisconsin, obviously with all of the social unrest and things that have been going on for the last few years, primarily this year, really wanted to take it upon myself to really get back in the community and do the things that I needed to do to make sure that our community is thriving and becoming more of an equal and equitable society for the rest of us. So when I was asked to do this session, to moderate this session, I was honored and excited to talk to some of the esteemed panelists that we have who are equally as committed and involved in the community. It really is just about healing the community and coming together, breaking silos to kind of break down some of the issues so that we can really change for the future and make this city, this country, a much better place moving forward for ourselves and our children and whatnot. So thank you for inviting me to moderate this, and I'm looking forward to this. So first and foremost, we're here together to talk about an ecosystem for change, right? If you guys are not from Milwaukee, I assume most of you are, you kind of do notice that while the city is diverse in nature, it is very segregated, especially when you look at locales and the different segments of society broken out across the city. And even those of us who are in the work and doing things in the community, we are still siloed to the point where we're all working on the same thing, but we're all doing them in our different lanes. And sometimes there is a lack of continuity between the two or between the different organizations and entities who are working together. So we want to have a conversation, discussion around what are the best strategies, innovative strategies to bringing people together and unifying our strategies, our initiatives, our goals around creating common goals that are going to make change in this society. So I'm going to ask a series of questions for our panelists. If anyone has any questions online, please feel free to ask those questions. This is, at the end of the day, a session for you guys, not for us, not for the panelists to be talking to you guys, but really opening up the discussion on the table to be honest and have the back and forth conversation that we want to have. Okay. So the first question I'm going to ask, and I'm going to open this up to all of our panelists, is what are some of the major issues that you guys are working on right now in your prospective fields or careers? And I'll just go down the line. I'll start with Danelle. Danelle, am I saying that right, Mr. Cross? Mr. Cross?
Yes, you are saying it right. Thank you so much, Jordan. So in Metcalf Park, we have a community reinvestment plan that the community has designed. It has 5 priorities. Well, with the onset of COVID-19, we had took a real deep look at what we needed to drill down on. And so some of those things included health and safety, which we believe that our mutual aid project serves to make some inroads into health and safety. Also, civic engagement. In our political climate, it is important that communities such as ours, which is primarily an African-American community, exercise their right to vote and to have their voice heard through the voting process. Another thing that is really important for us is to continue with engagement. And so we are doing multiple projects that bring people together in different ways and offer educational opportunities around advocacy and around community engagement, where they can engage people themselves block by block, and so that we will have a mobilizing force for change.
Okay, thank you, thank you. Zeno, Mr. Franco, how about you guys, or how about yourself?
Yeah, sure. So I think during the COVID period, and you can see my situation here, I put a jacket and tie on because you guys are all looking at my basement. So I figured I'd try to jazz it up a little bit. That's, I think, where we're all at right now is trying to kind of figure out how to navigate through this crisis period. And so one of the biggest ways that we've responded to it from the medical college is trying to get disposable face masks out to the community in mass quantities early on in the game. So between a partnership with the medical college, a small manufacturing firm in Saukville, and a number of other nonprofit and philanthropic partners, we were able to move about 260,000 masks out very quickly in the aftermath of the onset of COVID-19. And then we've ramped that up with Pfizer Forum and United Way, Just One More Ministries, and a number of other partners to get out 3.5 million masks to the community over the summer. And for me, what I've been really focused on is trying to get the messaging out into the public, really in 4 different minority or communities of color: African American, Hispanic, Southeast Asian, and Native American, about the importance of wearing masks, about the importance of taking the COVID-19 crisis seriously, and also trying to respond in a very culturally adapted or culturally tailored way with that public health messaging. So very careful translation, working with artists and community health workers in each one of those communities of color, so that we're really driving that conversation from within the community, and that the funding and actually the project management for that project is also driven by communities of color. And that's a $500,000 project. We're trying to make sure that through that, we're also providing diapers, formula, household needs directly to people who have been economically impacted by this crisis, and also to households that are COVID positive in our communities of color, so that there's direct support. And that project has been undertaken through a partnership with the City of Milwaukee, City of Milwaukee Public Health Department, the Office of African American Affairs at the county, as well as some of the different aspects of the medical college. And I think it speaks to the types of partnerships that are important in this work, and not just kind of doing it the same old way, the siloed way that you were getting at.
Great. Thank you, Ms. Franco. Mr. David Nelson, what are some of the issues that you're working on in your areas?
First off, I want to thank you, Jordan, for moderating this, and I want to thank the Greater Milwaukee Foundation for bringing us all together. I love the title of this, the idea of building community as an ecosystem. Too often in our world, and I've only been in Milwaukee 14 years, and I consider it home now, but too often in our world, we think of ourselves perhaps first. And in my time here in Milwaukee, I'm seeing a growing attitude toward collaboration, partnership, and building trust. Now, that's often easier said than done, but the things that have been happening this summer, from the murder of George Floyd to the Black Lives Matter movement to the pandemic, has really brought people together. It's funny, but Dr. Franco and I share an office at the medical college, and it is interesting to see him in his basement and me in my home office. And Ms. Cross, I know Metcalf Park. I know I've walked those neighborhoods. And so the work that I'm doing is really about that ecosystem. And for me as a researcher employed by the Medical College of Wisconsin, it's hard for me to separate my work from my friendships, from the partnerships, and even from my faith. And so as we think about this idea of collaboration and growing forward, we need to think about how we can bring all of those assets together. You mentioned, Jordan, that we are a community that has been known for its segregation, and you hear it often, time and again, you know, the most segregated city in the world. I really want us to be moving personally in our work towards that idea of how we can build to be the most collaborative city in the nation, if not the world. And I really believe we can get there with events like this and events that we can learn from one another.
Great, thank you. So that's a good segue. I was just making a note, and this is another open question for you guys. The purpose of this intent is to create that ecosystem and to create some collaboration. So how do we go from breaking down those silos to creating an ecosystem that is more collaborative? And what are some effective strategies that you guys have suggested or recommended or are implementing in your own professions that are doing that?
Jordan, can I answer that?
Yes, go ahead.
I'm excited. I'm excited about what David just said about bringing your whole self to the work. When I first started this work as a resident, I didn't know any of the rules of engagement, so I didn't follow any of the rules. I brought my whole self, so my faith is involved in this work. Is the reason that I move the way I do and have the strength to do it is my faith. My friendships, I brought to this work, friends with the community, and then new friends that I met along the way. And then my work and my vision for the future, I've learned to bring that into the work. When I first began, I did not want to bring myself into it with the community because I wanted it to be by their design. And it took a long time for them to tell me, no, we want to know what you think. We want you to express your opinions on these things. And so with their encouragement, I started to be able to not just be a support system, but to really be actively engaged together with them in the planning of what our community looks like, with them giving me the permission to do so. So I think that one of the things that hinder us from real collaboration is this over professionalism that comes into play, that people can't be transparent and open. They can't say some of the things that need to be said. And so just because I didn't know any of the rules, I was able to just be myself and say what needed to be said. And I think that that's what's really helped us to be able to collaborate with some and not collaborate with others. That we have, with our community, we have established a value system. And so that value systems guide our partnerships. And it's really awesome when you find a partner that shares these values, and they are out there. The other thing I would say is that many people have tried to force collaboration. It never works. It never works. I picked my husband. I picked him. And I don't like forced marriage, and that's what some collaborations feel like, forced marriage. And so most of the time they end in divorce. So I just think that these crises that we are going through right now have caused us to take off these different hats and just get together and say, what do we need to do? What can we do? And how can we help each other do it?
Okay, great. So, Mr. Frank or Mr. Nelson, and she mentioned the forced arranged marriage and, leads to divorce. What are some of the values or some of the things that you guys are looking for as far as partners when you're collaborating? Mr. Nelson, I'm sorry.
I love what Ms. Cross said there. And I'm fortunate my wife picked me, and sometimes I wonder about that, but she did. But I really like the idea of what Ms. Cross said about the idea of value systems. As a white man with some degree and some status at where I work, when it comes to the community, I really don't have it all figured out. I have spent probably 10 to 13,000 hours out in the community. And just when I have it figured, think I have it all figured out, something new is thrown my way. If we want to solve the issues that are facing us, we need to do so humbly, with answers at multiple levels, with expertise at multiple levels. And I really like what Ms. Cross said about permission. We need to, especially for those of us that have power and privilege, and I do, that I should seek permission and come so willing to learn with cultural humility. And when we do things more like that, we are more likely to develop that partnership, even with the massive differences that we have.
Great. So, Mr. Franco, in a perfect world, what would, in the city of Milwaukee and the surrounding regions and counties, what would collaboration look like to you if you had your say or your pick of the wood?
Sure. And I think, what's interesting is that, we all the folks on this panel have had a lot of experience working in partnership in different types of collaborations. I mean, to Dr. Nelson's point, tens of thousands of hours of this work over time. And it's an intense process, and when it's really working well, and when it's not. And we just went into this COVID rapid response grant process this spring. And I got thrown in with some brand new partners. And at first, I'm going to be frank, I was a little trepidatious. I don't know these people. I don't know if I should trust them. Never worked with them before. But they were hauling some butt. I'm just going to be point blank about it. And guess who it was? It was elements of the city and elements of the county. And I think having those different partnerships, sometimes we're afraid. I'm not sure if I would really want to partner with this type of group or that type of group. But it's those different kind of segments of the city that need to come together, because in a sense, the city government by itself can't solve all these problems. The medical college by itself can't solve all these problems. Frankly, the community by itself can't solve all these problems, because there might not be money, power, other types of assets that are needed to really move the ball. And so, you know, there's times when we're really afraid about certain kind of novel ways of partnering. And I think what this showed me is we were able to put together a partnership very rapidly that has actually been extremely effective and getting stuff done quickly, and actually navigating through some of the bureaucratic kind of traps that we get into sometimes, like a particular agency can't do XYZ thing. Well, we move some money to a different agency that can do that well and quickly, and we give something else to that other agency to do that they do well and quickly. And we're kind of navigating, and we're able to move a lot faster, I think, and more effectively doing that. So I actually think it's really possible. I'm going to say this, so that's the positive side. I'm going to say this in the negative side for a minute too, which is I've been on projects. I'm a Hispanic faculty member, okay? And so I'm very vested in issues around communities of color. But just because I'm a Hispanic faculty member doesn't mean that I'm not working across the entire city, because it's my personal belief that we are all elevated if we're elevated together. And there are moments in any big city, but I'll say this about Milwaukee because I think it's important to say, where the East-West Freeway is seen as a dividing line, where people of color are afraid to work together, right? And I don't know what all that's about because I'm not from here originally. I'm from the Los Angeles basin. And I'm still trying to figure that out. To Dr. Nelson's point, I'm trying to be humble in that I don't understand all the history in Milwaukee. But I can tell you that I also think that I have to bring my personal belief system to this, which is that we have to work together to get past some of the history that has profoundly crippled elements of our city in moving forward economically, professionally, and personally. We have to work across all the different lines, make the collaborations work to get us to move forward.
Jordan, Jordan.
Yes, ma'am.
I'm always interrupting.
No, go ahead.
I get inspired by certain words. And one of the things that really I'm inspired that we're talking about this is working across that bridge, you know, African American people, Hispanic, Latinx people working together. And I know it's challenging, especially with two groups of people who have been so marginalized, that the trust factor, whether or not my needs are going to be met through this collaboration. And so I have been fortunate to come across an organization called Freedom Inc. that has two parts to it, where it's African Americans, but I believe it's among people working together, two co-directors. And one of the things that really struck me was the truthfulness in what they share about how long it took for them to get to a place of trust and true collaboration. And I think that one of the problems in Milwaukee is that we think things are supposed to move at the speed of light, or is it supposed to happen during the course of a grant? And real relationship building and collaboration, especially with groups that have been so severely impacted, traumatized, takes time. And so I think that that it's a good place to start. Right now, it's a good place to start, but for people to understand that it's going to take years for that to happen. But we do need to figure out what's the starting place.
Yeah, absolutely. And I totally agree with that. And I think another issue is we sometimes, the Black and Brown community, we sometimes don't take the efforts upon ourselves to talk to each other and kind of build that rapport with each other and build that relationships. To have those candid conversations that say, hey, we're dealing with the same issues over here, just like you guys are. And if we can work together and get over that broomstick, that will help us out a lot more than being against each other at times. So I just want to make a quick announcement. We only have a few more minutes of this session, and then we're going to go into the breakout sessions. So if any of you guys out in the virtual sphere has any questions, please send them on the chat, and I'll make sure to get a couple of them in if I can over the next few minutes. But I do have one question, and this is for Dr. Franco and Dr. Nelson. You guys have the Thrive One collaboration, a new project. and it's a unique project on the north side of Milwaukee. Can one of you guys or both of you guys tell us what this project means for the community?
Jordan, I'm glad you brought that up. We are so excited about the Thrive On partnership with the Greater Milwaukee Foundation and the Medical College. Greater Milwaukee Foundation has been a part of the community for many years, but the Medical College, where it's situated, has not had that same footprint. And it, as we know, for those of us that practice community engagement, and Dr. Franco and I both do, that having that foot in the community, building those partnerships, walking the streets with the people means so much more than just having an office. And so we liken it to a place where people can come, as well as other researchers can be introduced to the community, and how we can build the community, the assets that we have at the college, as well as in the community around the idea of health for all people.
Okay, great. Thank you. All right, so now I put the question out for questions, so I have time for one or two. So I'm going to ask the first come, first serve. So I have a question. I'm going to give this one to Ms. Cross. And this is from Laura Hermans. She loves this vision of collaboration in Milwaukee we've laid out. So in your experience, what are things that get in the way of that vision?
One of the things that I think really gets in the way is our organizational goals can get in the way. That if we come in the door trying to figure out what we're going to get out of this, it kind of blocks us from building a relationship where we both are getting our needs met. And I think that the hardest thing I've ever had happen with people, because we work directly with the community, is for them to calm down about that right now and just start building the relationship. Build the relationship first. Don't just bring something packaged already and hand it to people and say, you got to take it, you got to take it. Build the relationship. Talk to people about your ideas and listen to theirs. The community might have a different way that you need to package something, and it will be your benefit to listen to their expertise. And so I think that's the biggest challenge, is for partners to understand that they have expertise at their fingertips, and not to pass up what the community can offer.
Thank you. So I have one last question, and then we're going to break out. I'm sorry for the questions that came rolling in right at the end, but I'm going to give this last one to Dr. Franco. And this comes from Wanda Montgomery. The community work that we're doing really takes a toll on us physically, emotionally, mentally. How do you guys, or how do you take care of yourself amidst all the chaos and keeping yourself fresh to continue doing the work?
Absolutely. It's a great question, Wanda. I think, I'm working with about 10 or 12 community health workers right now, all across the city, again, in those 4 different communities of color. And they're tired. There's a lot going on. And I'm getting phone calls from them regularly, daily, asking me questions. You can hear the frustration in their voice, because they're out there trying to make things work in the community for people who are, frankly, in desperate situations sometimes. And they see that the system's not all the way working for them to resolve this. And it definitely takes a physical, emotional, mental toll. And so one of the things that I've really encouraged the community health workers that I'm working with is not just to think about wellness or self-care, but to really be careful about boundary setting, right? So at the end of the day, that you try to put the work down, and that you stop thinking, if you can, about the family that that needs rent money, because you got to be back at it the next morning. And so I think boundary setting is a really key thing. And frankly, I think sleep hygiene is another major part of this process, right? So the stress starts to build up, and I mean, I felt it too. I've been restless for months because we have a lot of uncertainty, and I know the community health workers out there experience that as well. One of the other things that we've done is we actually had one of the community health workers that does a lot of video work and is from the Native American community, put together a video, and just the music from that I find very relaxing and powerful. And so I think part of it is also going back to our root traditions, right? And to be celebrating who we are in a deepest way in the process of giving back to the community, so that our own sort of well of ability and calmness is there for other people, but also for ourselves as we walk through the work.
Great, thank you. So that concludes this portion of the On the Table with the panelists. I'd like to give my thanks to the three of you for not just the awesome work that you guys do, but again, your willingness to be here and participate and lend us your voices and your experience. So thank you so much on behalf of myself and the Greater Milwaukee Foundation. So at this time, I'm going to hand off the conversation to Mrs. Wilson, who is going to give us our breakout instructions for the breakout discussions on the table.
Thanks, Jordan.
Thanks again.
Thank you.
Thank you, Jordan. Thank you, everyone. Great time. So we are going to go into breakout sessions. There is a link that's in the chat that has the questions with it that you all should click on at this moment, so that when you're into your breakout sessions, you can have those questions. Be sure to, you will get a notification that will say join this room. Just click on the link and join the room. And then once the time is up, we'll bring everyone back for a wrap up. So you should be receiving that join a breakout room link very shortly. Thank you all again for joining us. Thank you all and welcome back. I think that we all were in the middle of a sentence or a good idea or a great thought that we just needed to get out, and then it took us back here. But that's okay, because it's great to see everyone back together again. We are very grateful for your time that you've shared with us. Please feel free to check out On the Table MKE to learn more about how we can transform some of our ideas into actions to create a more positive Milwaukee. We are excited about we have another session scheduled for today at 4:30. It's called Funding the Front Lines. So if you have not signed up, please feel free to do so. And then join us for our next session tomorrow that we will wrap up with James Causey event, where we will speak about the recommitting to Milwaukee's promise, a conversation on how Milwaukee can reclaim its future as a community where every life is valued. We want to thank you again. Thank you, our panelists, our moderator. And if you guys have any questions or thoughts, or you want to take a moment and put your information in the chat, feel free to do so. But I hope that you all have a great rest of your afternoon and enjoy the rest of your week. And thank you for joining us. And continue to do great things to create a more positive, thriving Milwaukee. Enjoy your day. Bye.